Dr. John Torres, NBC News, here on this Facebook Live Daily Doc, we call it, where I try to give you some headlines, give you some information about those headlines, dig a little deeper into the story so you have a better understanding of it, and then answer your questions. And that's the part I think is most important, trying to find out what you're thinking about coronavirus, what questions you have, and answer those as best as I can. So please send us your questions. I'll get to as many of those as I can, and they're always fantastic questions. So first off, let's start with some of the headlines. And the number one thing, the numbers. Right now, we're looking at 4.6 million confirmed cases of coronavirus here in the U.S. As a matter of fact, it's 4,689,525 cases, according to NBCnews.com. And as far as deaths, which is one of the unfortunate issues with coronavirus, 156,000 plus deaths at this point. There are some predictions that according to modeling, by August 22nd or the end of August, they expect to have around 180,000 deaths. And the reason that's important is because that's showing us that these cases are more than just increased testing, that these cases are real cases that are popping up. And what we typically have are the cases show up first, a few weeks later, hospitalizations show up as people start to get sick from those cases, and then 4 to 6 weeks after that, we start seeing an increase in deaths because that's how long it takes for those deaths to lag behind all this. And so again, we're looking at very high numbers here, 4.6 plus million people with confirmed cases of coronavirus since the beginning of the pandemic, 156,000 deaths. Those death numbers are expected to go up, particularly because of the outbreaks we're seeing in some regions of the country. And speaking of those outbreaks, Dr. Deborah Birx from the Coronavirus Task Force, she leads the Coronavirus Task Force, actually came out saying, hey, one of the things that are going on right now is we're seeing changes in how these outbreaks are happening. If you remember back in April timeframe, March, April, when we were having the outbreaks, New York City was being probably the biggest area with the most number of cases at the time. Other areas in California, big cities, were seeing these outbreaks in cases. Well, now that has changed a little bit, and so it's changed to the point where now it's moving more into the Midwest, it's moving more into rural areas. And the reason she says that's happening is because Americans are more on the move. We are basically rotating through these different areas, bringing coronavirus to and from, and that's causing issues. And the biggest concern is the fact that people are still having gatherings. They're getting together, and they're particularly getting together indoors. In case you hadn't heard about it, in New York City, for instance, over the weekend, there was arrest of multiple people. The number they're saying around 170 people were on a party boat, essentially having a party in the midst of the pandemic, when the recommendations are small groups, 10 or less, outdoors more than indoors, a lot of social distancing, wearing masks, those things we know that work. But what's happening is you're seeing these gatherings are driving coronavirus forward, and we're seeing more cases across the country. And again, because we're seeing more cases, we're going to see more deaths as well. And so the idea here, the goal here is, and what Dr. Birx is saying, if we can make sure that we stay in those small groups, don't move around any more than we have to, definitely don't get into these large parties that are happening out there, then that can certainly help move things along. One of the big concerns coming up is the Sturgis Bike Rally, which is going to start next week in South Dakota. This year they're expecting 250,000 plus people at the bike rally. The concern is with people congregating that much, and the thought is this is probably the biggest rally, the biggest congregation of people that we've had since the start of the pandemic. We'll have to see afterwards what effect that has on people. But as I tell people all the time, the more people you're around, the longer you're around those people, and the closer contact you are with those people, particularly without social distancing or face masking, then the bigger chance you have of getting coronavirus. Again, for most people, coronavirus, especially if you're a young adult that has no other health conditions, typically not a big issue statistically, but it can have impact on certain people. We don't know exactly who those people are, so it's almost a random effect on people that you don't know going in if you are going to be affected by coronavirus or not, which means you need to protect yourself. On top of that, you could be carrying it to somebody else, not even know about it, bring it home to somebody who might be older, who might have medical conditions, and who might be more susceptible to complications from coronavirus. So we all need to be careful. And the four things I constantly talk about, which I know are boring for everybody, but wearing masks, social distancing, that 6-foot distance, making sure your small groups, 10 or less, the current recommendations, and lots of hand washing. Those are the things that are going to get us through this. Not only are they going to get us through this, but they're also going to get us to be able to reopen things more quickly, keep things reopened, because we're going to keep those numbers down. And so that's the goal here. So second story, vaccines. With the vaccine right now, we are getting a lot of information about the vaccines, the trials that are going on. A lot of vaccines are in phase 2 or phase 3 of trials at this point. According to sources, 150 plus vaccines around the world. There are around 4 to 5 that right now are in phase 3. There are 15 that are heading towards phase 3 overall. And what that means is once they start getting to phase 3 and they start looking at those tens of thousands of people they're testing, adults 18 and above, then we're going to find out more information about its safety and its efficacy. And one of the big concerns is how safe is this going to be? Well, talking to the experts, Dr. Hahn at the FDA, Dr. Fauci, they're all saying essentially the same thing, that even though it's much faster than it's been in the past, there are new techniques, there are new ways of doing things that make this vaccine much safer than older vaccines, and this development of vaccine much safer than they were in the past. So even though it seems to be fast, it's at a year plus time frame versus 4 years or 11 years for what it typically takes a vaccine. Because of techniques, because of procedures, because of understanding of vaccines, we're able to get a vaccine much faster. Plus, the amount of manpower around the world that's gone into making this vaccine is basically striving to make sure it's safe. That's one of their main goals. And the FDA has said they're not going to approve it unless it's safe. But granted, there will be a lot of public pressure, there will be a lot of political pressure to get that vaccine approved. So I'll be keeping an eye on it. I'll be continuing to talk to Dr. Hahn at the FDA, to other experts, to make sure that they're doing this safe and to relay that information to you. And then the third thing I want to talk about is when I talk about the vaccine, the other thing I want to talk about is distribution. One of the things they're looking at right now is how are they going to distribute the vaccine? Because you can imagine here in the United States, they're probably going to get 100 million doses to start with, maybe less than that. There's 350 million people in the country. So how are they going to vaccinate everybody? Even if they only look at adults, we're talking 250, 300 million adults, how are they going to vaccinate all the adults all at once? That's not going to happen. It just logistically cannot happen. That's impossible. So they're looking at who gets prioritized, and that's becoming a big issue as well that they're trying to work out right now. Time will tell what they actually come down with and what decisions they come down with. But typically, if you think about the flu is typically driven, its distribution is typically driven by local hospitals, local clinics, and how they order the flu vaccine and how they give the flu vaccine and distribute it once it gets into flu season. If you go back to 2009, the H1N1 pandemic, that's when the government stepped in and said, we're going to help out with distribution because we're in the midst of a pandemic here. We want to make sure that those that need it the most get it. So they restricted it to pregnant women, those that were elderly, those that had issues, and then they eventually opened it up to other folks as well. You might see that happen here. And what most experts are saying, what most of the people talking about the distribution are saying is that the most vulnerable, particularly healthcare workers, frontline healthcare workers, those that are frontline municipal workers that have to be out there with essential jobs, those with pre-existing conditions, and the elderly are probably going to be the first ones to get it. And looking also at people of color, because they're more susceptible to complications from coronavirus. Will they be getting it up, closer to the front of the line than others? We don't know at this point yet. And then eventually it'll filter down to the young adults with no medical conditions, no pre-existing histories, not at a higher risk of complications would they get as well. And so again, distribution is one of those things they're working on. This vaccine won't come out to the end of the year, beginning of next year, and so we'll find out what that distribution is over the next couple months, as well as what they're thinking about as far as safety. And I'll be keeping an eye on that for everyone here. And then the third one is the flu. Some interesting news, a silver lining to all that's going on here, is we have found out that around the world, the flu cases have gone down dramatically, and the reason they think they've gone down is because of all the measures we're putting in place to try and avoid coronavirus. The social distancing, the wearing masks, the not being in large groups, washing our hands. Those are helping with flu. They're helping with mumps and measles. And the example I can give you is in the southern hemisphere, when it's winter and when it's summer here, it's winter in the southern hemisphere. The flu is a winter type virus. And so down in the southern hemisphere, particularly in Australia, this time of the year, usually their hospitals are inundated with flu cases. They're seeing a record low number of flu cases, again, because of the measures that are being taken. In China, same thing with measles and mumps. They're seeing low numbers of cases of measles and mumps, again, because of the things that are going on here. These are both respiratory type viruses. The flu is more respiratory droplets. The measles is more the airborne particles that are out there. And so taking these measures, understand that you're not just protecting yourself from coronavirus, you're protecting yourself from flu, measles, mumps. Best thing you can do in addition to that is definitely get the flu vaccine, especially as we approach what we call the second wave of coronavirus, which is going to take place October time frame. You want to make sure you're protected from the flu. So number one, you don't confuse the two if you do get sick, and number two, that if you do have the vaccine, you're less likely to get the flu or get complications from it, which means your immune system is less likely to take that hit from the flu, which will leave it more vulnerable to coronavirus and its complications. And so again, we're seeing these things. The numbers, to recap, they're going higher. We expect them to go even higher. Part of that has to do with not listening to the guidelines and the advice as far as social distancing, small groups, those types of things, wearing masks that can help out. And we're seeing more gatherings of people. If we can limit those gatherings, then we can limit the cases of coronavirus and the outbreaks. The vaccine, again, we talked about the distribution. How's that going to be worked out? They're looking at that right now to try and figure out what they're going to do. And the flu, the fact that the flu numbers are down in areas that are typically hit by the flu right now because of the measures that are being taken to try and get coronavirus under control. But now let me see if you have any questions.
How would you know if the vaccine is safe for children or elderly?
So the question is, how will you know if the vaccine is safe for children or elderly? And that's a great question. As far as the elderly, right now the phase 3 trials, which is the last part of the trials, they're looking at people 18 and above. Phase 1 and phase 2, if you remember that, is typically 18 to 55. Well, now they've opened it up 18 and above, so they're actually bringing in a lot of volunteers that are 80 plus age of years old. And so they're looking at the elderly and how they end up having issues, and basically anything that might go on with the vaccine during testing. On top of that, they're also looking at people with pre-existing conditions, as long as those pre-existing conditions are what they call stable, meaning that they haven't changed medication, they haven't changed treatments over the last 3 months. So if it's stable diabetes, if it's stable high blood pressure, if it's stable chronic renal insufficiency, then those are the kind of people they're looking for as well to test to make sure it works across a broad spectrum of individuals. What they're not looking at are the children. And that's one of the things that we're going to have to try and figure out. So initially what they do in this phase 3 is look at adults to make sure it's safe and effective. If they find out particularly it's safe, then eventually down the line, they'll start testing it on children. But they definitely want to make sure it's safe in adults first before they start testing it on the children. Have not gotten to that stage yet. More than likely, they'll get to that stage towards the end of the phase 3 testings, or even after phase 3 is done. That'll be the next phases of testing it at phase 3 in children. But so what that probably means is when the initial distribution happens, probably won't happen for children, those under the age of 18, with the thinking being that children, even though they can get cases of coronavirus, even though they can get complications from coronavirus and spread coronavirus, they're much less likely to do so than adults, especially the very young children. It seems like the younger you get in age, the less likely you are to have complications from coronavirus. The older you are, the more likely you are to have complications. So even though they can get issues, they can catch coronavirus and get complications, they're less likely. And so those distributing the vaccine and testing the vaccine are saying, let's make sure it's safe first, and then we'll start testing it in children. Once we find out it's safe in children, we'll start distributing it in children.
Can you get COVID-19 through your ears?
So the question is, can you get COVID-19 through your ears? And at first glance, this might seem like a funny question, but it's actually a very logical question, because we always talk about not touching your face to make sure you don't get coronavirus before you wash your hands, and make sure you limit how many times you touch your face during the day. Well, for most people, your face includes your ears, so you want to make sure, again, that you don't touch your face too often. You do wash your hands before you touch your face, but that's mainly because of getting it into your eyes, your nose, your mouth, where you can get coronavirus. The virus can get into your body. The virus mainly gets into your body through breathing, respiratory droplets, but it can get in through contacts in limited numbers of cases, and that means if you touch a surface, the surface is dirty, and you touch your mouth, your nose, or your eyes, you can get it that way. Same does not apply to your ears. You cannot get it in through your ears if you touch your ears alone. But obviously, if you touch your ears, if somebody coughed near your ear and it got around the ear, you touch your ear and then rub your eyes or wipe your nose, then you can get it that way, certainly. But getting it solely through your ears, no, because you have a tympanic membrane that separates your outer ear from your inner ear and inside your body. And so there's no communication between the two that germs can pass through. But not a bad question.
What about taking the antibody test and timing of that? How long should I wait to do that after testing positive COVID?
So the question is, when should I take the antibody test after I tested positive for COVID? Current recommendations right now are just looking at the COVID test itself. If you test positive for COVID, once you get through your isolation and once you get back out to going out and about, a lot of people want to get retested. What the CDC is saying, don't get retested for COVID-19, what we call the diagnostic test. Don't get that for 3 months, because you want to make sure that everything is cleared out of your body, because you might get what's called a false positive, meaning it might detect viral particles that your body is still trying to clear out and say you're positive, when in fact those viral particles are just dead leftover parts of the virus and you don't have active virus in your body. So that's a diagnostic test. Now the antibody test is different. The The antibody test tests to see if you had coronavirus in the past and your body has built up antibodies against that virus. But the way our bodies work is there's two different types of antibodies that initially crop up fighting against coronavirus. The first one is IgM. IgM is a very short-term one that over the first couple of weeks ends up being developed in your body to fight off coronavirus, but it's kind of a general antibody. And then your body develops a more specific antibody towards coronavirus called IgG. That takes around 4 weeks to develop. So recommendations are 4 to 6 weeks after you get tested positive for coronavirus to get tested for antibodies. So again, you want to wait that 4 to 6 weeks, because if you get one only 2 weeks out, those IgM antibodies could have gone down to the point where they're not detectable, and the IgG antibodies haven't gone up to the point where they're detectable, so it might not show any antibodies. When in fact, if you wait a couple more weeks for that 4 to 6 week time period, then you might show antibodies there. So that's the best time to get it.
My teenagers have been kept away from everyone. Will this compromise their immune system going forward?
So the question is, my teenagers have been kept away from everybody. Will this compromise your immune system going forward? And a lot of people often have a theory of it's best to get my child, basically have them get attacked by the virus so they can go ahead and get immunities to it. That's not the way this works, and it shouldn't work this way at all. So just because your children, your teenagers have not been around people, have not been affected by the virus, doesn't mean you're going to have issues with their immune system. Will they be more susceptible to coronavirus? Sure, because they haven't been affected by it. They don't have the antibodies built up to it. But on the flip side of that coin is we don't know, even if you had coronavirus, how long those antibodies your body develops will last and how much protection they're actually going to give you. And so some people have had, in the past, people have had chickenpox parties. They've had coronavirus parties to try and get themselves or their children affected by coronavirus so they can get through it and get a built-up immunity. Not the thing you want to do. You want to make sure you protect them as much as possible now. And like I said, we have a couple of things going on. Number one, of course, the vaccine that we talked about will be coming out, and that'll offer protection in that case. Number two, as time goes on, we have a better understanding of how to handle and treat coronavirus. If you notice that our treatments now are different than they were 3 or 4 months ago, because we have a better understanding of the virus, how it affects the body, and how to treat it. So more time that goes on, the more likely we are to have an understanding of how to treat that, especially in teenagers. And so the more you can delay them getting it, the better overall. And so again, you don't want to have those coronavirus parties where you intentionally get them infected to try and build their immune system. That's not the way this works. But let me recap again. These are fantastic questions. What we talked about today. Number one, the numbers. 4.6 million cases at this point, 156,000 plus deaths, unfortunately, as well. We're going to see both those numbers go up. Number two, vaccine. The distribution is going to be the big thing that's going to be talked about over the next few months, because once the vaccine comes out in December, January, February timeframe, how is that going to be distributed? It's going to be very important to figure that out, to make sure it's distributed in an equitable fashion, that those that need it the most get it first, and then the others get it subsequently, because there's going to be a limited number of vaccines. And we hopefully won't have political issues associated with it, financial issues associated with it. Hopefully it gets done on a very equitable basis. And then last is the flu, the fact that the flu, measles, and mumps are decreasing in other parts of the world because of the measures we're taking to protect people from coronavirus. So a little bit of silver lining to the coronavirus cloud here. But this is Monday. We're going to find out more news as the weeks go on. I'll have another Facebook Live at the end of the week. But in the meanwhile, I hope you have a fantastic week. And as always, I hope you, your family, your loved ones stay happy and they stay healthy. Thanks.